Menasha has developed a comprehensive RX to OTC program to support pharmaceutical manufacturers' switch from prescription to over-the-counter sales. OTC switches can be a substantial growth catalyst for your pharma company, but the merchandising supply chain involves many steps and complex processes. Navigating through them can be a real pain, and it's probably not a core competency of your company. There are companies and solutions that help with parts of the process, but the result is that you need to engage multiple suppliers, which slows down speed to market and increases overall costs. Or you can turn to your trusted partner, Menasha, to handle everything. We offer the only comprehensive end-to-end solution. We start with pre-sale switch support, offer packaging and display solutions, manage the entire supply chain, and bridge the gap that exists with retailers, with all the work being done in our FDA-registered facilities, resulting in increased conversions and substantial sales growth. Menasha's RX to OTC program. Making the switch has never been easier. Learn more at rxtootc.com.
Target has been in the retail clinic business since 2006. We're actually one of the founders or involved with the founding of the retail clinic model. We currently have 69 clinics in 7 different markets, and we're really excited about that opportunity to bring some low acuity, high volume services and prevention services to our guests. In 2014, we will do what we do each year, which is we reassess what it is that our guests are needing in markets that we're in, where it would make most sense for us to put a clinic business to serve our guests' needs. And over the last couple of years, that's been in the 12 to 15 clinic range. At Target, in our clinics, we offer over 60 different services, and most of those are in the low acuity, high volume service space. We also offer a host of vaccinations and the wellness screenings that you mentioned, along with camp and sport physical. And so we are constantly looking at that menu of services that we offer and looking to see where it is that we can provide those services that are convenient and affordable for our guests. Like many, we are following the Affordable Care Act and the effects that that is going to have. We know that there's continuing health care costs in the system. We know that there's going to be more people with insurance. That's going to be coupled with a shortage of providers, particularly primary care physicians. And so we continue to want to look at where it is that we can add value using our clinics and our pharmacies and looking for partnerships, because we really think that we need to be part of that larger healthcare ecosystem to help our guests as best as we can. Engagement is very important, and I think we all would agree that healthcare is anything but simple in most cases. And we have found a way to take the best of what retail has to offer from a standpoint of simplifying offerings and helping the guest understand what those choices are. So the retail clinic, from a transparency of pricing standpoint, the guest experience or engagement. Another example is how we work with our pharmacy team to engage our guests, and having recently been announced as the highest in customer experience for mass merchandisers for pharmacy is an example of the results of that focus on the guest. Medication adherence is a big issue in this country, and it can lead to unexpected ER visits and hospitalizations, which not only drive cost in the system, but not many people want to spend their time in an ER or a hospital. So in our pharmacy, we have a pharmacy team that not only is engaged with our guests, but seeks to understand what those barriers are to care and works with them to address those, whether it's financially through our $4 and $10 generics, whether it's through reminder systems and using Target's mobile system to get reminders for medication, or connecting back with physicians and helping to understand how it is that we can work with that broader system to address those needs. The pharmacy industry, for many years, it's been okay for us to just fill prescriptions and make sure that they're safe, that we get the right pill and the right bottle for the right individual. We know now, with increasing costs across the system and guests becoming more consumers, that we need to offer not only a great experience, a safe experience, but we need to play a role in helping people address barriers to adherence. We need to play a role in chronic disease management. We need to continue to expand services like our medication therapy management program. And these are the types of services that are going to help keep us relevant to our guests and to payers and providers. Target Clinics right now is playing a role as a trusted partner. We see that we can add a lot of value to some of the physician groups who are feeling pressure to perform on quality metrics and reduce the cost for the care of their patients. So we offer up some of these low acuity, high volume services that we can offer to physician groups so that they can focus on some of the sicker, more chronic illness patients to help reduce those costs. We have examples of relationships in several markets with physician groups that we work with. One of the more recent ones would be with Duke University in the Raleigh-Durham market. And we spend a lot of time working with them on how to leverage that clinic relationship and make sure that there's open communication for the continuity of care that occurs. Simplicity is very important for Target's healthcare offerings to our guests. A couple of great examples in our pharmacy on how it is we apply simplicity is, number one, our ClearRx bottle, which is currently in the Museum of Modern Art in New York for its design and how it brought simplicity to people being able to read the bottle and use the bottle. Another great example is our Pharmacy Rewards program, and that's very simple. For every 5 prescription fills that you have, you get 5% off of an entire day of shopping at a Target store. Very simple, very easy, and that helps with our guests from an experience standpoint and helping them engage with our pharmacy. In 2014 at Target Pharmacy, we look to continue to build on the great guest experience that we've offered. We're very excited about continued growth in our immunization program year over year. We're excited about some guest tools that we've launched. There's a mobile service as one example for guests to use that to manage their medications, which could include refill reminders, reminders to take their medication. And we are also excited about expanding our medication therapy management program to new markets.